I could probably record it too.
Yes. Hello, everybody. My name is Dr. Noël Crosby, and I'm an audiologist and the creator of Odd Bliss. Odd Bliss is designed to provide resources to people who otherwise wouldn't find them or have them locally regarding their tinnitus. I am going to be interviewing different guests, and today I am excited to have my guest. Her name is Dr. Katie Awoyinka, and I hope I said that correctly. She goes by Dr. Katie, and she's here today to talk to us a little bit about her tinnitus program. She is in Minnesota, and I'm just going to ask her a few questions as we go along. So, welcome, Katie. Thank you for being here.
Yeah, thank you for having me.
Yeah, and like just tell us a little bit about yourself.
Sure. So I am an audiologist and the director of hearing and balance at an ENT clinic in Minnesota. I have been at that practice for about a year now, but I've worked with the physicians longer than that. We have a very unique approach at our clinic. We work with both more traditional treatment and management of ear and vestibular disorders, and then also include more of a holistic approach. We incorporate things like essential oils, and then more like sound therapy, things that can look at diet changes, things that look more at the whole person, and treat. We try and manage symptoms and treat more holistically.
That is very interesting. My whole premise in doing this was to add different things into the tinnitus arena that people hadn't heard of before. So a lot of that was the holistic side of it. And so when I heard what you were doing in your practice with your ENT, that really excited me that there was somebody out there actually realizing that some of these things can work and help people.
Yeah.
I believe that not every treatment works for everybody, but some treatments work for some people. But if somebody doesn't know something is available, how can it help them? Right.
Right. Yeah.
So what made you want to focus on tinnitus in your practice?
Yeah, I've worked with a lot of patients with different types of hearing loss. In the ENT field or in the ENT side of audiology, we see a lot of different pathologies, a lot of different causes of hearing loss. I work with um, an ENT that specializes in Meniere's disease. So, with Meniere's or some of the other pathologies, we see a really big range of symptoms, and tinnitus is a big one for a lot of people. And I heard over and over from my patients that if they could pick to cure or help manage one thing, that would be the tinnitus. So even if they had a very significant hearing loss, the tinnitus is really what was bothering them most in day-to-day life. So I wanted to explore that a little further and be able to support those patients more.
Yeah, that's wonderful. I love seeing younger audiologists out there really trying to make a difference. But tell me a little bit about what makes your tinnitus program unique. I know you said that you do, there's some essential oils and some other things, but what other alternative type things do you have that you do with it?
Yeah, so I think a big thing that I focus on is trying to look at people's lifestyles. So we do start with a very comprehensive case history and really find out what patients have tried that works and doesn't work, what can make their tinnitus worse or better that they've found. Kind of look at their lifestyle, where what's being impacted, where their biggest concerns are, and that can help kind of guide our program. So for some people, that is looking at either some kind of device, so like a hearing aid or a masking device. For some people, that's all they need, and we can take care of that pretty easily. Some people need a little bit more lifestyle changes or suggestions for things like sleep or stress management. So we try and explore, and I kind of give people ideas to try. With around like sleep health or stress reduction, provide them with some different apps to try on their phone, things that they could just start implementing right away based on what they're telling me.
Yeah, wonderful. And can you think of a patient that you helped or share a story about somebody where that really you made a difference in their tinnitus and in their life?
Yeah, I can think of a few, but um, I would say one that comes to mind would be a patient with I've seen with chronic ear diseases or chronic ear problems. So they've been dealing with tinnitus and fluctuating hearing loss. So hearing loss that changes day to day or week to week. Um, and that was really challenging for them. And then tinnitus would go along with those fluctuations. So one thing we really looked at was setting up a program for them, which included a hearing aid with a masker, and then allowing them to have multiple programs or memories they could switch into, and really giving them some control for when they had good and bad days. And then we also really explored um, the patient was having trouble with sleep, so we kind of really explored what she could try with different sleep techniques and trying to take care of that too, which can in turn help with the tinnitus.
Right. Thank you for that. I think it's just really patients have so many tinnitus patients have just been told there's nothing that can be done for them. And I think somebody like you just taking the time to figure out really what that person needs can make a big difference to them. So let's look at if somebody would want to work with you, either
Mhm.
locally or possibly virtually. Tell me a little bit about how they would contact you, or let's talk about first about locally and then about whether you're providing virtual services and how somebody would contact you for that.
Yeah, so right now I'm working in Blaine, Minnesota, which is a suburb of Minneapolis. So for anyone that's local in the Minneapolis or Twin Cities area, we see patients. We see patients, really they do come a long ways. Even some patients from northern Minnesota or North or South Dakota will come and visit our clinic, and we're happy to accommodate different schedules if people are traveling. And so locally, I'm at Minnesota Ear and Sinus Center. So it's MN Ear and Sinus Center. Their phone number is 763-225-5732. And so there's we're also incorporating online scheduling now. So there's or you can call to schedule. So we're really trying to provide a lot of access to getting scheduled with us.
Okay. So let's say somebody wants to just, they don't live in Minnesota, but they're really interested in just finding out more information about you and what you could do to help them. What would they need to have before maybe contacting you, or what would be helpful for you to be able to give them some advice virtually or set up a virtual appointment?
Yeah, so we are working to kind of look into details of virtual visits, specifically for tinnitus or audiology. Um, kind of payment or insurance wise, but otherwise we do have the capability to do that. So one thing that would be really important is if a patient had a recent hearing test or audiogram report so that we could see if they had hearing loss, what that looked like. Um, so that would be something we would do if you came in locally. Otherwise, if you were virtual, we'd want to see that beforehand. And then for patients that are coming specifically for tinnitus, we do have them fill out some tinnitus inventory forms or questionnaires. So that can help us just get an idea of what areas of their life are being impacted and how significant that is for them. So that would be something that we could send out to patients.
Okay, wonderful. So I know with COVID, with this, we could do some telehealth, some virtual things, even with
Yeah.
hearing devices, but most of us never did it. But I know since all of this has happened with COVID, we've all trying to figure out ways to do things more virtually. And
Yeah.
sometimes it actually works a little better, right? Because you get to take some time and really get to know somebody and you're not rushing around in your office. So, yeah, so I'm sure if somebody's interested in contacting you regarding that, I'm sure you'll be making progress in how you'll be setting that up.
Yeah, we've even with the newer hearing aid technology, a lot of our patients are snowbirds, so they leave for the winter and go somewhere warmer. So we've
Probably
been
to
able.
my area
Yeah, exactly.
in
Yeah.
Florida.
They leave us. So, it's been really nice. We've been able to do virtual adjustments on their hearing aids or just check in virtually, which, so that technology's come a long way and been really helpful for patients that, or they just don't want to drive in or come in because of COVID. So that's been
Yeah.
really nice.
Yeah, I find that there's so many wonderful resources that we can provide to patients now.
Yeah.
So, in wrapping up, just let me have a summary of what advice could you give to somebody who's really struggling with tinnitus, who wants answers? What would you might want to say to them to make them feel a little bit better?
Yeah, that's a good question. I would say the biggest thing is to not give up hope on trying to feel better with managing tinnitus. There is a lot of resources now, and the resources continue to expand. So, um, to keep looking for someone that can help you and things that work for you. Like you mentioned, not everything works for every person. So, kind of keep exploring the options until something works for you. It's not that we're looking for a cure for the tinnitus, we're looking how to manage it or make it less of a burden or less bothersome. So, and that definitely can be possible.
Yeah,
I think the biggest thing that I talk to patients about is creating a sound enriched environment. So, really breaking up the contrast of how loud that ringing feels. So, finding sounds that are calming and relaxing to patients, and just have that either through an app or listen to it out loud, or just something that can really relax the systems, or any stress management can help a lot.
right. Well, wonderful. It was so nice getting to know a little bit about you today and your tinnitus
Thank
program.
you.
This video will be available on Facebook on Odd Bliss, the page Odd Bliss, and then it will also be available on the website, and you may be watching it at one or those places. But if you'd like to email Katie, did you give us your email address?
Oh no, so it's Dr. Katie, DrKatie at MN Ear Sinus.com.
Perfect. And I will also post that too.
Perfect. Yeah, and I am feel free to email. I'm a lot quicker at email than phone calls, but I will return a phone call too.
Okay, wonderful. Well, it was great again having you on, and I'm hoping that this interview will help somebody in some way.
Yeah.
And we'll be back with the next interview in a little while. Thank you very much.